An internal transportation of the canal is termed a ledge, and frequently results when clinicians work short of length and screw instruments into canals. Many ledges are successfully bypassed using the techniques described for blocks. Importantly, pre-enlargement of the canal coronal to the ledge is necessary, as this procedure paves the way for the subsequent introduction of pre-curved files. Once the tip of the pre-curved file is apical to the ledge, it is moved in and out of the canal utilizing very short push-pull movements with emphasis on staying apical to the defect. When the file slides easily, it is turned clockwise upon withdrawal, because this motion will tend to straighten the apical 1/3 of a stainless steel file and allow it to rasp, reduce, smooth, or potentially eliminate the ledge, which is typically on the outer wall of the canal curvature. When the ledge can be predictably bypassed, then efforts are directed towards establishing patency with a tin file. Gently passing an O2 tapered tin file 1 mm through the foramen increases its diameter to 0.12 of a millimeter and paves the way for the 15 file. Ledges may be classified into two types. A Type 1 ledge can be safely eliminated with attention towards observing the 4 shaping objectives to maximize remaining dentin. A Type 2 ledge should not be eliminated. Continued shaping procedures may potentially weaken or perforate the root. Let's take a look at how to manage both of these types of ledges. Plastic block scenarios allow us to best visualize their management. Here we have a plastic block with an S-curved canal. Notice at about the junction of the middle and the apical 1/3, there's debris, which infers a block, and you can see that there's a minor ledge. At a higher magnification, you can clearly see the ledge. Although we've emphasized the importance of viscous chelators to manage blocks and ledges, in this plastic block scenario, so you can visualize the management of these procedures, we'll use an aqueous solution. As per usual, we use a stainless steel tin file, and it must be pre-curved. Putting a nice rolled radius on its apical extent allows the instrument to move through multiplanar curvature as we advance it deeper into the root. Notice as we come up against the obstruction, the file will not move apical. Little short amplitude vertical strokes begin to engage the end of the file, and you can see it beginning to move just apical to the debris and bypassing the ledge. Little short amplitude strokes move debris into solution, so that when we re-irrigate, we can flush out some of this debris. Again, the pre-curved file is brought into the root. It's orientated so that it moves past the ledge and a little bit deeper into the canal. I want to emphasize the importance of taking short little strokes when the file is apical to the ledge so that we can smooth and refine this region of the canal. Remember to work in a fluid-filled canal. Again, the pre-curved small hand file more predictably now bypasses the ledge, works deeper into the canal, and continually refines and expands the glide path. We use a pro taper, Shaper 1, to flare and brush cut the coronal portion of the canal and improve access. This generates quite a bit of debris and necessitates continuous irrigation procedures after each rotary instrument. With improved access, the small pre-curved hand file is free now to go to length. It's worked repeatedly in short amplitude strokes until it is loose. Irrigate and recapitulate and re-irrigate. Well, we've worked a 10 and 15 hand file to length until they were loose, but the ledge is still present. Let's look at ledge management. As we saw earlier in the show, we can take a rotary pro taper instrument and convert it to a manual file using the snap-on handle. A bird beak plier can be used to put a nice rolled radius curvature on the terminal extent of the instrument. By reciprocating the handle of the file, we can walk the tip of the instrument and bypass the ledge. Because this instrument has greater tapers as compared to an ISO O2 tapered file, a little bit of rotation on the handle draws the instrument in and begins to buff out the ledge on the outer wall. Irrigate, recapitulate, and re-irrigate to move debris into solution. To progressively manage the ledge, we use a pro taper Shaping File 2. Again, the pre-curved instrument bypasses the ledge. Its greater diameter cutting blades refine and smooth and plane the walls and begin to reduce the ledge even further. This instrument is worked until it achieves length. After every greater tapered instrument, irrigate, recapitulate, and re-irrigate. Here we use the finisher number 1. Notice again that it's pre-curved, and the pre-curved instrument readily bypasses the ledge. This instrument has a 7% taper in its apical extent, and because of this taper, it very nicely can refine and smooth and eliminate the ledge in its entirety. Notice how the debris loads up on the instrument during the cutting action, whether we use a reciprocating handle motion or a balance force technique. Irrigate, recapitulate, and re-irrigate to move debris out of the tooth. When the canal has been optimally cleaned, we want to gauge the foramen with a 20 hand file. By tapping on the handle gently, we can determine if the file is snug at length or loose at length. A medium, non-standardized master cone is selected and trimmed so that its apical diameter matches the last file that was snug at length. The cone is fit in a fluid-filled canal. Following Type 1 ledge management, notice how easily and freely the master cone slides to length. Let's look at how to manage a Type 2 ledge. Again, we have the block with the S-curved canal. Notice that there's more debris in this block than there was in the previous case we just managed. Notice the ledge is probably 50% at least larger than in the previous example. Ledge management is always performed in a fluid-filled canal. A pre-enlarged canal allows a pre-curved file to be easily inserted down to the iatrogenic event. Notice in this orientation, the pre-curved file bottoms out on the shelf and is limited in its ability to move apical. With a little bit of orientation, the file readily drops through the debris, and again the short amplitude strokes move a lot of this debris into solution. Irrigate, recapitulate, and re-irrigate. It's important when pre-curved files are placed apical to the ledge to stay at this position and work the instrument deliberately and repeatedly, because this procedure refines and expands the glide path and makes it easier to introduce progressively larger instruments. The next sequential instrument is the 15 file. The instrument is pre-curved as usual, the handle reciprocated to walk the pre-curved instrument past the ledge. The instrument is worked continuously in an apical direction until we achieve length. Rotary instruments are used to pre-flare and further expand a shaping wave in the coronal 2/3 of the canal. This is the Shaper 1. After it's used, notice the debris needs to be flushed out of the tooth, and again we recapitulate with a small file to make sure we still have that glide path. Let's focus on ledge management. The Shaper 1 is converted from a rotary instrument to a manual instrument, and again its apical extent is pre-curved. The pre-curved instrument can easily move through the pre-enlarged canal, and its terminal extent can be moved past the ledge, and the instrument is rotated, or you can use a reciprocating handle motion until the instrument achieves length. The next sequential instrument would be the ProTaper Shaper number 2. Again, the pre-curved instrument is going to be reciprocated until its working end bypasses the ledge. Each one of these ProTaper instruments has multiple changing tapers over the length of their cutting blades, and these greater tapered instruments then can begin to refine and expand the glide path, and we can do some ledge reduction. Again, after its use, irrigate and recapitulate and re-irrigate. The recapitulation file again is used in little deliberate short amplitude strokes to move debris into solution so that when we re-irrigate, we can liberate that debris. The next sequential instrument is the ProTaper Finisher number 1. Again, the pre-curve instrument can be readily passed through the pre-enlarged canal. A clockwise rotation moves this instrument in, and its 7% taper begins to carve the shape in the apical extent of the canal. The instrument is worked until it achieves length. Following its use, we irrigate and recapitulate and re-irrigate to liberate the debris from the canal. Move the 10 file in short amplitude strokes to encourage debris removal. Following the use of the Finisher 1, we gauge with a 20 hand file. Again, we trim a non-standardized medium master cone such that its terminal diameter matches the last file that was snug at length. This master cone can be put in a dappen dish of alcohol to encourage it to hold a curve, and we'll look at this in just a little bit. Following the shaping procedures, notice that the ledge, although reduced, is still present. In Type 2 ledge management, it isn't always wise to try to remove the ledge in its entirety, or we could predispose the root to either a strip perforation or weaken the root and predispose it to a longitudinal fracture.